public health, a social policy problem, and a criminal justice problem, working together would have great benefit not only to the prison population and reducing that those costs, but also to improving the safety and security of our neighborhoods and our streets. So I look forward to bringing these staffs on board, working with Congress, listening to the suggestions from Congress as we deliver and put together the President's strategy.
On the day that you were confirmed as director, the Consolidated National Drug Control Budget for fiscal year 2010 was released. And did you have any input into the formation of that 2010 budget? And what significant differences do you think there will be between a 2010 budget and a 2011?
I did not have the opportunity to weigh in at all on and until confirmed took absolutely no actions, even though I was the nominee. I know that in speaking with the President and in speaking with the Vice President, my position in our office will have a great deal of input in putting together the strategy for the next go-around.
It seems that the disparity between powder cocaine and crack cocaine disadvantages minorities. And we've had trouble in our courts. I mean, we have a large percentage, I'm from California, of our young black males in prison, more than are in college. And that statistic cannot continue. So I would hope that as the director that you would look into that disparity and look into how we can support the programs, walk-in programs. When I was in the Senate and chairing the Health Committee, year after year, we would introduce bills that would allow storefront treatment centers that people could walk into. The conservative administration always said it would be too costly. Well, it costs the lives and the careers of our young people. So I hope you will look deeply into that as you begin your work. Thank you.
Please be assured that I will. Thank you.
Thank you.
I thank the gentlelady. Chair recognizes the gentleman from Massachusetts, Mr. Tierney.
Thank you very much. Thank you, Mr. Kerlikowske, for being here today. Can you share with me what the rationale was behind reducing the amount of money that went into the high-intensity drug trafficking areas program? Do you have some data or some evidence that contradicts what we've been hearing from law enforcement personnel that, in fact, it's useful and helpful?
I'm a strong supporter of HIDAs. I served on the HIDA board in Seattle and believe, as other members have stated, that they are useful. I don't have the particular details of the budget issue. I know that the law enforcement agencies would always appreciate more assistance. Meeting with the HIDA directors, 5 of whom I'll be talking with tomorrow in Nashville, is something that I will certainly explore further.
Would you? Because I mean,
Yes.
I know it's one thing they always want resources, but I'm sure what they don't want is a reduction if they can really put the money to good use.
I agree.
So I'd appreciate if you'd examine that with them and then let us know what your result is of that, whether you think the $14 million reduction was appropriate or whether you've revisited it after you've met with them.
I will.
Thank you. Do you have a position on the so-called gateway theory, the
No,
idea of focusing resources on marijuana use for young people? And
I don't. I've read a lot of research and a lot of literature. You cannot deny that people that are using much stronger drugs than marijuana often started with marijuana. I think there is a disagreement among the academics and the researchers on whether or not marijuana is in fact a gateway.
okay, thank you. Do you have a position also on Narcan?
No, I don't. I've been in office 8 days. I know 36 years of law enforcement. I have a lot to learn.
Okay, no, I thought you might have bumped up against
No.
it in Seattle.
I've seen the use of the preventives, and I've seen the use of bringing people out of the heroin overdoses by drug treatments. But these are medical areas that actually I'm being briefed on almost immediately.
Well, there are some people, obviously, who feel that its success actually works counter because people are going to start relying on it being there, which I think may be a bit of an odd way to look at things on that if you can save a life. But I'll look forward to talking to you next time we have you in and see what you've developed for a theory on that.
Thank you.
All right. Thank you. I yield back, Mr. Chairman.
I thank the gentleman. We're going to request of a number of people on the subcommittee. We're going to go to another round of questions, Mr. Kerlikowske, and then we'll go to the next panel after that. Now, in your position, will prevention be a big item?
Yes.
Well, given that preventing substance abuse is the most cost-effective method to reduce the costs and consequences of addiction, could you explain why the President's budget proposal to reduce prevention funding by 10.6% has occurred? How does that square with your philosophy?
I would tell you that my ability to influence or be involved in this budget process was nil. I know that prevention is an important part of the Obama administration. I'll be working very hard on this next presentation and on the President's drug strategy, and that prevention will be an important component.
So would you recommend that they not cut funds for prevention?
I actually don't know enough about the details of the 2010 budget as much as I have looked at tons of material already in just a few days.
Are you familiar with the proposed elimination of state grants portion of the Safe and Drug-Free Schools and Communities program?
I am.
And do you agree that would leave schools that do not receive a grant from the national program without funding for even minimal drug and violence prevention in schools?
Mr. Chairman, I would answer it this way, that any of the programs that are not shown to be effective need to be looked at and either need to be reduced or eliminated, but I do not have the details of how that was evaluated and how that was looked at.
Given that you're, as you have said many times, 8 days on a job, I think it would be helpful for this committee to receive from you information on your position as to how prevention programs will manage with a reduction, and whether or not most local education associations actually use the money that comes from the Safe and Drug-Free Schools Community Program to leverage other resources and to develop consortia to pool their resources to provide optimally effective programs and services. Well, we need an analysis from you on that. If you've, as you've said, just come into this recently, it would be helpful to understand how your positions will square with some of the budget realities. Finally, the Ondcp is statutorily required to set quantifiable goals for reducing illicit drug use and the consequences of illicit drug use in the United States, but rarely has done the latter. In particular, the agency has never set quantifiable goals for reducing fatal drug overdoses or the spread of HIV/AIDS, even though rates of both are relatively easy to calculate. As director of Ondcp, you have broad statutory latitude to set both national goals and performance measures. Will you set short and long-term objectives for reducing the harms associated with both drugs and the war on drugs? If so, what performance measures will you focus on? And finally, will you consider adding additional measurement criteria and performance goals related to drug overdose deaths, HIV transmission rates, and the number of hardcore addicts?
Mr. Chairman, the metrics and the measures project is already underway within Ondcp, using a wide variety of data and to establish the measures and to see how we're doing against our goals will be very important. It can't be limited to just a few small measures, and I agree with that. We'll be asking for a lot of input, and particularly input from the members of the committee and your staff.
Okay. I'll yield to Mr. Jordan for 5 minutes.
Thank you, Mr. Chairman. Mr. Kerlikowske, the gentlelady from California, I think, asked you earlier about the needle exchange program, and you said you'd get back to her. How soon do you think you can have an answer to this committee about your feelings about that proposal, and specifically in light of the President's comments about that concept?
Mr. Jordan, I would tell you that the needle exchange issue, the medical marijuana issue are, and several others that have been mentioned here, are all high priorities for me. I'm doing my very best to kind of get my arms and head around the agency right now.
3 months, 4 months, 6 months, what do you think? And Mr. Chairman, if I, maybe be appropriate, obviously it's the chairman's call, to have the director back at some point. He's talked about several times about 8 days on the job, which I understand. I mean,
You know what, I was thinking the same thing, and I would, let's have our staff work together with Mr. Kerlikowske for a follow-up meeting so we can do some benchmarks here and measure the progress. So the answer to that is yes.
Thank you, Mr. Chairman. And if I could, before I forget about it, ask unanimous consent to submit 2 articles from last spring. One says Vancouver's injection site proven ineffective and cost prohibitive. The other says the UN says safe injection site should be closed, just for the committee.
Without objection, so ordered.
36 years, you said, Mr. Kerlikowske, you've been working in the law enforcement field. Tell me, just as with that experience, what is it that leads a person down this trail? I mean, I have my theories. Mine deal, frankly, with the family life or lack of family life, particularly a mother and a father there to provide some of the guidance and discipline that parents provide. But in your 36 years of that, just give me, what is it that pushes a young person into this terrible lifestyle?
You know, when I was pretty young in this business, I think I had all the answers, and now that I'm almost 60, I'm not sure I have even the right questions. I would tell you that I think it is infinitely complex. I think it begins with parents. I think issues of prenatal care, parent coaching, early childhood programs, Head Start, neighborhoods, communities, religious, faith-based, et cetera, are all important. I also think that the medical testimony about addiction as a disease is also of critical importance. If I knew the one answer that heads them down that path,
what's your best guess? What do you? I mean, you actually made me.
Yeah.
You talked about what you thought you knew when you were young. We all have that. It reminded me of a statement. Mark Twain had a great line. He said, "When I was 10, my dad knew everything. When I was 20, he didn't know much of anything. Now that I'm 30, I'm surprised how much he's learned in 10 years." So it sort of works that way for all of us, I think. But if you had to say one thing, would you say it's a lack of a mom and a dad there doing the stuff that parents do?
I'd say family and parent issues, neighborhood and community are of critical importance. Getting parents off to the right start and getting children off to the right start would make all of my former colleagues, police chiefs and sheriffs' jobs a heck of a lot easier.
Let me ask you one other thing real quick here. The Southwest Border Counter-Narcotics Strategy, you mentioned in your testimony, your prepared testimony, that this has undergone an accelerated review and update. Talk to me about that. And this, again, sort of gets back to my first round through when we talked about what's going on the border. Talk to me a little bit about that in the remaining minute I have.
Sure. I've had an opportunity to look at what would be the final draft of that policy. I have not had the opportunity to talk with the Vice President and the Secretary of the Department of Homeland Security about it, but I know that earlier she had asked that Ondcp be much more heavily involved in this issue, and I plan on taking that up as quickly as I can.
Okay. Thank you, Mr. Chairman.
Chair recognizes Mr. Kennedy.
Thank you, Mr. Chairman. I'd like to, for the record, just submit the articles that I was referring to before.
So, without objection, so ordered.
Thank you. I'd like to also submit a letter from my own State Department of Health. We have a needle exchange program in Rhode Island that's reduced transmission of HIV. And
without objection, so ordered.
Thank you. If I could go to the issue of getting your support for this ESPERT, early screening, brief intervention, and treatment. If we could integrate into our healthcare system drug counseling, screening, and so forth, and make it as routine as a diabetes screen or anything else, it would destigmatize it, and it would also help us on that prevention end that the chairman said is the cheapest way for us to tackle these problems. And if you started it with, if you had it with every doctor, no matter what specialty they had, and you reimbursed them for it, and I mean white coat docs, so they don't have to be mental health docs or substance abuse specialty docs. Every doc got to be trained in this. Can you talk about how that would be really revolutionary in terms of advancing this cause, in terms of public health? And would you be able to join us in the effort to write to the medical boards that put together these tests for medical schools and encourage them to put more questions on the tests vis-a-vis drug and alcohol training and questions and mental health, so as to encourage medical schools to put their curricula more in line with the patients that their future physicians are going to see, i.e., every patient they're going to see is going to have a cross-section of being a whole person, not only there for, you know, whatever specific malady they might be going to a specialist for, but they're also going to have a complement of mental health and emotional issues as well. And now their doctors are going to be also able to be trained to deal with that, just maybe in a cursory public health way.
You know, I've had 2 initial briefings on the program. I am a supporter of the program. The analogy would be that as we educated and informed physicians to ask patients, particularly their female patients, about domestic violence and inform them and educate them about domestic violence, that it can help to reduce that. Having the physicians also do the screening and the discussion with their patients, regardless of what they come in to see that physician for, about addiction and substance abuse, would be a great step forward, and I am supportive of that.
And as my colleague, Mr. Cummings, mentioned, there's all kinds of folks out there hanging their shingle saying they're drug treatment folks. And as my other colleague, Mr. Jordan, said, you know, some of these treatment things just don't work. Here's evidence that this guy was in umpteen different treatment things and he never got well. Are you for making sure we have some national standards on putting in place maybe JCO or NCQA standards for treatment facilities, just like we have for every other health facility, so that we can implement what works in the treatment world?
Congressman, I'm not prepared to talk about whether or not I would support particular standards. I would tell you that the treatment issues are very important to me, that people looking at treatment as not just a 12-step program or a 30-day inpatient program as being a measure of success. There are a lot of people that take medications for high blood pressure for their entire lives. They take statins for cholesterol, and looking at treatment perhaps in a different way than just in and out and cured is probably not the best viewpoint.
Well, I just say that airline pilots and doctors have 96% success rate in drug treatment. Well, they have to. I mean, obviously, they're flying our planes and operating on us. Let's get what works and appropriate to everybody.
Thank you.
Thank you. Gentleman's time's expired. Thank you very much. Chair recognizes Mr. Cummings.
Thank you very much, Mr. Chairman. Let me ask you this. You know, we authorized Ondcp back in 2006, and when I was a ranking member. And tell me, we're going to hopefully do it in 2011. What are your recommendations for topics we should be addressing? Are you familiar enough to answer that?
I would tell you that in looking at the reauthorization, I was surprised at the level of detail and complexity, and I think it reflected disappointment with Congress's view of how ONDCP was operating. I would hope that in the intervening time that we would develop a relationship and trust about what works and how we can come together, and that during the reauthorization process that we be given the tools at ONDCP to be more effective than we have been in the past.
Just recently, about a month ago, as a matter of fact, a group of us traveled to Panama, Colombia, Brazil, and Mexico. And it's so interesting in Mexico, the top law enforcement officials were telling us, and you've heard the stats, that I think he said 80 or 90% of the guns, and being a law enforcement person, you can, I'm sure, sympathize here and empathize, were coming out of the United States. And these were the same guns that were being used to fight the police and the military with regard to drugs. And I'm just trying to figure out how the president's in a very tough position. You have a country who basically says we want our guns. You got the NRA with their position, but at the same time you got Mexico, which is saying, United States, you're largely responsible for our problems. One, you're consuming the drugs, and two, your guns are coming down to us, and so we got a double whammy here. I mean, how do you make your voice heard under those circumstances, considering all the political, I mean, this is very real. And what they said to us is that they believe, I'm talking about the high-ups, I'm not talking about folks, I'm talking about the top people. They told us that this Mexican situation, drug problem, is already spilling over into the United States. It's going to get worse. Then when we went to Colombia, President Uribe, who we met with, literally begged us to make sure when we came back to the United States that we did everything in our power to make sure that there was maximum cooperation between the United States and Colombia with regard to drugs. And that was very personal to me because 90% of the drugs that come to Baltimore come out of Colombia. So I'm trying to figure out how you're going to make your voice heard. And you were selected for a reason. And I don't know all the background, but I'm sure there were some interviews and you had to say, this is my plan, this is what I hope to do. And everything I've heard about you is you're a no-nonsense person. You're very serious about what you do. But I'm trying to figure out, how do you see your way in addressing issues like that? Because this is serious business. And as the president of Colombia said, you know, it would be good to be able to stop it here, because no matter what, I mean, when it hits your shores, it has done and will continue to do a lot of damage.
You know, at this point in my career, I didn't want to come to Washington without being able to make a difference, Congressman. I can tell you that all of my association with all of my colleagues across the country, they want to be a part of this. I was very heartened by the immediate steps Secretary Napolitano took to reduce guns flowing into Mexico and also bulk cash flowing into Mexico. I've had several briefings just within the last week on Mexico, and I know that with our southwest border strategy about to be delivered, that those issues have been added and will be addressed. You know, I've never been a shrinking violet on a lot of these tough issues, and I don't plan on changing my stature in this administration.
I thank the gentleman. The chair recognizes the gentlelady from California.
I remember going down to Cuba, and we met with Fidel Castro about 4 or 5 years ago, and he said that, you know, if you could relax the restrictions. He says, we're 90 miles off your coast, and we see the boats coming through here and going up to the upper 48. And he said, if we could do interdiction together, we could stop that traffic. And I'm just wondering, do you see a time, and I would hope under your leadership, because we've needed a drug czar, that we join with the Cubans in interdicting this drug trade? Of course, we have a big problem because that's where the money is. And we're having problems in California over our border.
Yes.
Tijuana, right over the border to Los Angeles. Of course, they're having more in Texas and New Mexico. But do you see a future where we can join with Cuban interdicting, and we can, I guess we have to go back to the present, because I see the problem really at the top. Our President Barack Obama was there a few weeks back and met with the President. But we have to join both countries and some of the island nations if we're going to stop the flow. But the need is so great for drugs here. And I think a lot of the advertising that we see on television, that we hear on radio, contributes to that, take something to feel better. Well, when that something wears off, you still feel the way you did, even worse before. So what do you see for the future? What would you lay out as a plan to join with other countries and have a united effort to stop the flow?
Having spent some of my career in Florida, I was certainly familiar with the steps that were taken. One of the next trips that I'll be taking will be to Key West to meet with the joint task force that works that entire Caribbean, South America, Central America, the entire region. So I'm looking forward to learning a lot about that. I can tell you that it's probably premature for me to actually even engage in a thought right now about the relationship with Cuba when it comes to drug interdiction, but I can tell you that shortly after I visit with the commanders in Key West and spend more time with the State Department officials, I'll know an awful lot more about that issue.
Thank you very much. Again, we want to thank you for your service. We look forward to working with you. The challenges are indeed great, and you have a major, major job. I've often said that our children are the living messages we send to a future we will never see. And the question becomes, will we send them to a future? And so we know that you're up to the task. We look forward to working with you closely. Because we, again, want you to be most effective and efficient. And thank you again.
Thank you all very much.
All righty. We'll call now the second panel. Gail Christopher, the chair of the National Academy of Public Administration panel on the Office of National Drug Control Policy. John Carnival, internationally recognized expert in the field of drug policy, President of Carnival Associates, LLC. Professor Peter Reuter, Professor in the School of Public Policy and the Department of Criminology at the University of Maryland. And Bobby Charles, the Charles Group, LLC. President, he is the president of that organization. After serving from 2003 to 2005 as Assistant Secretary of State for International Narcotics and Law Enforcement. I'm sorry, you all got to stand up again. I have to swear you in. This is one of the few committees where you have to do this. Please raise your right hand. I hereby affirm to tell the truth, the whole truth, and nothing but the truth. All right. You may be seated. Ms. Christopher. It is Ms. Christopher's. Ms. Christopher?
Yes.
Doctor, I'm sorry, doctor.
Thank you.
Doctor. I always try to make sure I give people their due. Those degrees are hard to come by.
Okay.
Well, for me it was. Let's say it like that.
Thank you. Chairman Cummings, Ranking Member Jordan, and distinguished members of the subcommittee, Thank you for inviting me here today. I am honored to appear before you to discuss the National Academy of Public Administration's 2008 study and report entitled Building the Capacity to Address the Nation's Drug Problems. It was my pleasure to chair the Academy's ONDCP panel of 6 members with diverse backgrounds in fields such as public health, social policy, law enforcement, public management, budget, and policy analysis. The purpose of the congressionally mandated study was to provide insights into changes and improvements that could make ONDCP more effective in the future. Underlying all of its recommendations is the panel's firm belief that ONDCP's adoption of a comprehensive approach to multi-year strategic planning informed by the best available data will help the organization to accomplish its mission. The panel's recommendations embody principles, tools, and processes that will maximize ONDCP's effectiveness under any administration and any director. The ONDCP challenge is to compile a comprehensive strategy that overlays the strategic plans of the numerous diverse agencies and ties the many pieces together in a common national program without conflicting with the individual agency's strategic plans and budgets. Let me begin by acknowledging the very encouraging way in which the new ONDCP Director, Kerlikowske, with the support of Acting Director Ed Jureth, has adopted a very energetic agenda to resolve many of the issues that the panel reported and that my written testimony describes. His endorsement of a comprehensive multi-year national drug control strategy, the creation of a policy budget steering group, reestablishment of the Drug Demand Reduction Interagency Working Group, commitment to reaching out to stakeholders, and the variety of efforts he has undertaken to reinvigorate the ONDCP workforce should have a dramatic and positive impact on ONDCP's mission and its success. I'll summarize the following selected recommendations which relate to the issues this subcommittee has identified for this hearing and would ask that the complete report be entered into the record. ONDCP should develop a comprehensive multi-year national drug control strategy that is informed by high quality and diverse data and that covers all age groups, illicit drugs, and regions of the nation. ONDCP should bring to bear the full range of the nation's drug control expertise and build an internal culture that values critical inquiry, open debate, and pragmatic decision-making. ONDCP should develop a comprehensive national drug budget summary informed by that multi-year strategy, which incorporates total estimated federal expenditures for all supply reduction, demand reduction, and other federal drug control activities, as well as state, local, and tribal affairs activities related to drug control. Further, Congress should modify ONDCP's oversight responsibilities relative to individual agency drug budgets so as to tie its review more closely to the annual OMB budget review process. ONDCP should no longer require drug control agencies to provide performance reports that merely duplicate the GIPRA and PART data that is gathered for OMB. The panel believes that ONDCP's energies are better spent assisting agencies in improving the performance measures that they use to generate the data so that the measures align with the overall drug control strategy. In addition, ONDCP should continue working on measures that assess the aggregate performance of drug control agencies in addressing the goals of the national strategy. ONDCP should work to create a more collaborative and consultative environment in order to increase its effectiveness in its relationships with Congress, the National Drug Control Program agencies, and stakeholders throughout the nation. And we believe that that process has already begun with the new administration. ONDCP should comply with statutory requirements, provide information to Congress in a more timely manner, increase the ability of the drug control agencies to have meaningful input into the substance of the strategy, use working coordinating committees to expand its outreach capabilities, and institute a regular feedback mechanism with national drug control program agencies and stakeholders. As ONDCP celebrates its 20th year of existence, the panel believes the organization has the opportunity to enhance its effectiveness and its credibility, increase transparency, streamline its organization, simplify its work processes, bolster its workforce management, and improve and leverage critical relationships. Seizing this opportunity can translate into increased organizational capacity to address the nation's drug challenges with positive implication for the nation's public health and certainly for the nation's future. Thank you, and I would be happy to answer any related questions.
Thank you very much, Dr. Connerell.
Good afternoon, Mr. Chairman and members of the committee. I want to thank you for this opportunity to present my views on ONDCP's past performance, key actions and recommendations to restore the integrity of that office, and the fiscal year 2010 National Drug Control budget. I have a formal statement which I request be submitted for the record.
So ordered.
The committee asked me to discuss ONDCP's failures and its loss of status that occurred during the previous administration that could very well affect ONDCP's future effectiveness. I will highlight just a few of the findings I have in my written statement. The first one is that ONDCP did not properly align the policy with the federal drug control budget to implement it. In fact, policy and budget were exactly at odds with one another. The strategy essentially had one demand reduction goal, which was to reduce drug use among youth and adults, but had a budget that emphasized supply reduction. Second, there was no accounting for the performance of that strategy. ONDCP ignored the congressionally mandated requirement for a systems approach to strategic planning, which includes performance accountability that looks at the effectiveness of policy. It instead relied on OMB's PART process that is program-oriented rather than policy-oriented. Number three, ONDCP jettisoned the statutorily required consultation process. Had it consulted and collaborated with external stakeholders, perhaps it would not have completely missed the meth and prescription drug epidemics. Four, ONDCP failed to recognize the softening of youth attitudes about the dangers of drug use that began in 2005. This new trend signals the very real possibility that youth drug use will now increase. Cutting prevention funding by 10% during the prior administration's tenure was wrong. Five, ONDCP jettisoned much of the drug budget even though Congress required a comprehensive accounting of federal drug control resources. Billions of dollars in federal drug control spending were ignored. This made it impossible for all of us to be smarter about drug policy decision-making. So looking forward, what do we do to improve ONDCP's effectiveness? I have three recommendations, Mr. Chairman. Number one, ONDCP must meet its statutory obligation to take a systems approach to design the National Drug Control Strategy. This systems approach is described in great deal in my written statement and is very much part of the statutory authorization of ONDCP. Number two, ONDCP must heavily invest in demand reduction, in other words, prevention and treatment. This means preparing immediately for the possible resurgence in youth drug use and tackling addiction. More demand reduction will also eventually mean less crime and violence for nations like Mexico as we reduce our long-term demand. Three, with regard to the National Academy of Public Administration's recommendations, they did an outstanding job, and I have a lot of, and they have a lot of great recommendations that I strongly support. However, there are two that I believe must be completely ignored. Apologies to Dr. Christopher, please. First, the Congress and the administration should not implement the recommendation to essentially turn the budget process over to OMB. I worked in OMB in the 1980s, and I remember what that process was like when we were in charge of the budget and when there was no drug czar. We just witnessed in the fiscal 2010 budget what can go wrong when OMB is in charge of the national drug control budget. We now have a policy budget mismatch. Prevention is being cut at a time when it is most needed. Second, The Congress and the administration should not accept Napa's recommendation to also turn performance accountability over to OMB. Napa's recommendation shows that it failed to recognize the critical difference between between program versus policy or strategy performance evaluation. ONDCP must rebuild a state-of-the-art performance accountability system along the lines of what it had in place in the late 1990s. I want to conclude by briefly talking about the new administration's FY 2010 budget request. It is my view that the new administration has gotten off on the wrong foot. I am disappointed by the proposed drug budget. For example, the FY 2010 drug budget continues cuts in prevention, particularly school-based prevention, and adds very little money for substance abuse treatment. This decision, presumably by the Office of Management and Budget, strengthens my point that the Napa recommendation to essentially turn budget decisions over to OMB is wrong. Again, let's not put OMB in charge of the drug budget. This concludes my comments. Thank you for the opportunity to appear before you today, and I'm happy to answer any questions you may have.
Thank you very much, Mr. Ruda.
Mr. Chairman, I appreciate the opportunity to testify before you this afternoon. I ask that my full statement, written with Jonathan Calkins of Carnegie Mellon University, be entered into the record.
I can't hear you. I'm sorry.
I ask that my full statement, written with Jonathan Calkins of Carnegie Mellon University, be entered into the record. Okay. Is this not coming through?
I can't hear him.
Okay. Can I start over again?
You just keep your voice up because it's just coming. It sounds. It's not clear.
Thanks. Mr. Chairman, I appreciate the opportunity to testify. Okay. I ask that my full statement, written with Jonathan Calkins of Carnegie Mellon University, be entered into the record.
Very well.
Right. Professor Calkins and I addressed three issues in our testimony. First, we point to the importance of distinguishing among broad classes of drugs in making policy decisions. Much confusion results from treating all illegal drugs as a single policy target. For example, diverted pharmaceuticals present very different problems and policy opportunities than do cocaine and heroin. In this oral testimony, though, I will focus mostly on our second issue, which is incarceration related to cocaine and heroin. I'll just briefly discuss foreign policy issues. The United States now has probably 500,000 individuals under lock and key for drug offenses on any given day, including the substantial numbers who are in local jails for drug charges. To put that in context, it's about 22% of the total prison population. It's more than the countries of the European Union, with their 400 million citizens, are able to put away for all criminal offenses. Even more to the point, it's 10 times as many as were imprisoned at the end of Ronald Reagan's administration, when the drug problem was probably at its peak. What has been the return for all this incarceration? The mechanism that links drug incarceration to drug use is price and availability. Tougher enforcement should make cocaine and heroin more expensive and less available. As is well known, the purity-adjusted price of cocaine and heroin have fallen steadily since 1981, when systematic measurement began. According to a recent analysis done for ONDCP, the decline for cocaine continued through 2007, even as the Mexican market descended into chaos. The availability measures based on population surveys have shown only modest declines for cocaine over that same period. There probably has been a reduction in the number of regular users of cocaine and heroin over the last 20 years. However, that is more plausibly related simply to the working out of epidemics, cycles of fashion and culture, as indicated by the rapid aging of the cocaine and heroin-dependent populations, though incarceration certainly has had some modest effect on the numbers. Indicative of the aging, the share of those treated for heroin, cocaine, and methamphetamine dependence who were over 40 rose from just 13% in 1992 to 31% in 2004. What if the nation moved to a prosecution and sentencing regime that over the next few years reduced the number of drug prisoners to a mere 250,000? We believe that there is good analysis and argument that such a change would have minimal effect on drug price and availability. It would, however, save society substantial monies, and with appropriate alternative sanctions would also reduce the harshness with which the governments treat poor minority communities. Any case for cutting drug imprisonment should not pretend that prisons are bulging with first-time non-violent drug offenders. Most were involved in distributing drugs. Few got into prison on their first conviction. They had to work their way in. The system mostly locks up people who have caused a good deal of harm to society. Most will, when released, revert to drug use and crime. They do not tug the heartstrings as innocent victims of a repressive state. Nonetheless, locking them up should be the last resort, not an automated response. Let me turn briefly to foreign policy issues. Two countries supply the U.S. with almost all its imported drugs, Colombia and Mexico. Afghanistan is the third country that matters, not because its heroin reaches these shores in great quantities, but because the heroin industry helps keep the Taliban funded and also by financing warlords weakens the central government. Again, the historical record and analysis both strongly suggest that there is little that can be accomplished to reduce the flow of drugs to the United States with interventions in other countries. Eradication and interdiction can affect where coca and opium are grown and the routes by which cocaine and heroin are trafficked. But the process of moving the industry around the world is quite damaging. A new producer or transit country is likely to be hurt more than the original country benefits from a shift in the business. At a more micro level, spreading coca growing to more parts of the Andes through intensive eradication efforts causes substantial harm to the ecology of the region. It is hard not to act against production and trafficking that hurts the United States, but we present arguments that such policies may cause more harm than good. Thank you very much.
Thank you very much. Mr. Charles, good to see you again.
Sir, it is always a pleasure to be in front of you. My thoughts today are elementary. I have a few simple, if strongly held, views to share. I find myself, by the way, in strong agreement with most of what Dr. Christopher and Dr. Carnevale had to say. My views are neither Republican nor Democrat. They are what I'd like to think of as common sense. They emerge from 2 decades of work in demand and supply, advising federal, state, and local law enforcement, as well as state and national prevention, education, treatment, and law enforcement groups. They are distilled from a range of experiences, spending time as a U.S. Circuit clerk on the U.S. Court of Appeals, in jails, schoolhouses, treatment facilities, and places as diverse and regularly there, Colombia, Bolivia, Peru, Mexico on one hand, Thailand, Malaysia, Laos on the other. I've even had the good fortune of hunkering down in Baghdad and Kabul to talk about counter-narcotics, and the sad task also of helping parents who have lost kids to drugs refine their life's purpose. Professionally, my views, as you know, sir, better than most, are molded by 5 years up here on the Hill. During that time, I ran the Bipartisan Drug Policy Working Group, co-chaired by Congressman Zeliff and Rangel, Speaker Hastert Drug-Free America Task Force subcommittee that you were the ranking member for, that elevated and vetted drug-related and demand and supply reduction legislation, including the 1997 Drugs Are Reauthorization Act. Finally, between 2003 and 2005, I was Colin Powell's Assistant Secretary handling narcotics issues in 70 countries, which brings me here today as nothing more than a commentator. My short thoughts are these 5. Number 1, to cast the nation's counter-narcotics efforts over the past 2 decades as a waste of time, as misguided, as a failure, is simply wrong. We have collectively succeeded in many ways. For periods of several years at a time, during both Republican and Democratic administrations, we have managed to change attitudes and behavior patterns. The data is all there. We have managed during these high-attention times to educate young Americans well, to pull more addicted Americans back from the abyss, to reduce emergency room admissions for various illegal drugs, to reduce certain categories of violent and property crime tied to drug use, and concretely return the rule of law and stability to formerly drug-ravaged countries, and we can detail those if you want. Number 2, what we have not been able to do in any permanent way yet is to erase the recurring need for education, treatment, and deterrence born of keeping narcotics at the front and center as a law enforcement and national security issue, community, family, and personal responsibility issue. We have not found a way yet to sustain national will and attention around a topic that few like to discuss, either in their own lives, the lives of their families, or even schools and communities, never mind the nation. We have yet to erase the reality and the enormous heartbreak of drug abuse and addiction, drug-related accidents, drug-related suicides, the tragedy of sudden death by drugged driving, which is quite common, falling educational performance tied to drug dependence, drug-related abuse of women and children. By the way, both the Clinton and Bush Justice Departments put 80% of overall abuse, that is to say domestic abuse, at the feet of substance abuse. Much of it is polydrug use. We haven't been able to get away from the drug-related violence in our towns, cities, and at the southwest border. And yes, drug-funded terror groups, which now number more than 25, increasingly encroach on U.S. interests around the world and do include Hezbollah, Hamas, the PKK, mutations of the KLA, the FARC, AUC, Taliban, HIG, IMU, and a growing number of terrorist cells in this hemisphere. We do not even need to utter the word Afghanistan. Portions of some of these groups are amply financed by our own drug abuse right here in the United States. So despite successes, we face a challenge as meaningful and compelling as any that the nation has wrestled with in decades. Number 3, America needs to focus on both sides of drug abuse and drug crime, adequately and sustainably supporting both the health and law enforcement sides of our personal, family, community, state, and federal anti-drug efforts to minimize the role of either law enforcement, often dubbed the supply side, since the aim is to deter drug production and trafficking, or the health-related requirements, including prevention and treatment costs, the so-called demand side, would, in my view, be a sudden turn for the worse. Moreover, to minimize either deterrence and what it takes to deter drug-related crime or health and prevention would be reckless. Number 4. Drug legalization is a non-starter, period. I have 2 studies that I would urge being put in the record, one of which is a robust economics study on that topic. One of my graduate degrees is in economics. The economics of drug abuse, written large and small, are against anything like legalization. To gain new perspective, just ask Sweden or the non-addicted people in any country where drug availability has risen. More drugs means more addiction, higher health care costs, lower educational performance, more property and personal crimes committed on drugs, which are 6 times as likely as crimes committed to get drugs, more domestic abuse, and a degradation in a variety of related health indicators, from inhibitions against unprotected sex to shared drug needles. What is more, the nature of addictive commodities and sliding price elasticity of demand for drugs means that any legislation widening availability and use will accelerate emotional and physical damage to the very youth we hope in so many other ways to protect. To that, add the persistence of a drug black market, both empirically and because addiction means there will always be a black market until the day when drugs like heroin are given away 100% pure in any quantity that somebody wants. In short, the case is a slam dunk against drug decriminalization or legalization or harm reduction, and the irresponsibility of discussing it as a real option is tantamount to discussing some other way in which we might legally conspire to victimize and deceive our nation's young people so as to pay our way, which actually it would not, out of state or federal debt. No, there is no saving grace to promoting drug abuse, full stop. 5. Hope springs eternal for ways to save and protect young lives, to improve everything from education to deterrence. This Congress and this drug czar and president have a chance, a real chance, to show real leadership in the drug war, which has been lacking. Whether you prefer to talk about anti-violence or pro-law enforcement end of the spectrum, or the pro-healthcare end of the spectrum. The spectrum, like any criminal issue with health consequences, from rape and maiming to assault and intentional infliction of emotional distress, is a continuous, unbroken, integrally related circle, trying to fix the health consequences residing on one side of the circle without deterring the behavior and the means that create the opportunity and promote the other side, the ill health consequences on the other side, is to miss the point. Both sides of this battle need our attention.
Mr. Charles?
Yes, sir.
Can you wrap up?
I will. We must minimize the level of inattention that has been given to this, maximize the attention, and remember that in a nonpartisan way, quite frankly, we are due for some real leadership on this issue.
I want to thank all of you for your testimony. Mr. Christopher, Dr. Christopher, tell me, in its report, Napa cited a lack of expertise in the workforce at ONDCP, saying that they needed more to be able to accomplish their mission. What types of skill sets and expertise are needed most to make the organization effective and efficient?
Thank you for the question. Since the first priority for ONDCP is to understand the scope and nature of the drug problem, it first must have competent statisticians who are equipped to utilize the wealth of survey data that is available to gain a better understanding of the many facets of the drug problem. And certainly the idea of a new deputy that brings a medical and preventive background speaks to the skill deficit in a very effective and creative way. The office also requires competent economists who are able to conduct in-depth analysis of the global drug market. Understanding markets generally is one thing, but understanding a complex global illicit market with limited market indicators is another, more difficult assignment. Much data is collected about the illicit drug market demand, but less is known about market supply. This is an area where ONDCP can truly provide valued added as a coordinator of the National Drug Control Program. The Academy report also focused in on the need for more diversity of the agency staff, given the disproportionate impact of these issues in diverse minority communities.
Dr. Carnival, one of the things that I'm concerned about is the whole drug court situation. I think drug courts are very effective, and it seems to me the President's budget calls for $59 million of new problem-solving, it says, quote, problem-solving courts initiative. And apparently what that means is that there's the discretionary funds, and then drug courts have to compete for those funds. Are you familiar?
I'm somewhat, excuse me, Congressman, yes.
Are any of you all familiar with that?
I'm familiar with the program, yes.
Bobby, Ms. Charles?
I can't say for sure.
And
but I am
that
familiar with the
concerns me
program.
because I think drug courts have, as I said before, have been very effective. They put a carrot and stick approach. In Baltimore, we have found them to probably, I mean, and this is basically talking to judges, which, I mean, and judges are not, they have no reason to exaggerate, but they claim that it's one of the best tools that they have. And so I'm just wondering what you all's opinion of, you know, putting money out there so that these drug courts that are already scraping for money, trying to find money wherever they can. As a matter of fact, one of our drug courts in Baltimore basically has had to go to some private foundations and whatever, trying to put together the pieces for something that has been very effective. And I just wondered what you all's opinion on that might be.
Let me say, Mr. Congressman, I am 100% for it, and I will just tell you, as you know, probably as well as anyone, over the last 8 years, the Burn JAG grant money was dramatically cut from what its high of $1.3 billion at the end of the Clinton years, and it's a travesty that we have lost that emphasis. Some of the money actually goes to that purpose, just as it's vital to restore the safe and drug-free schools money.
Could I just add? One of the problems with the drug courts is that the eligibility criteria for defendants are so strict that, in fact, it doesn't make a large difference in the great body of criminal justice decision-making. In fact, if you're an experienced heroin addict, you're almost certainly not eligible for a drug court simply because you'll have accumulated a criminal history that doesn't allow you in there. I think the advances in drug courts will come from changing the eligibility criteria, which is not actually, I think, on the agenda yet.
Well, I can tell you, in Baltimore, they would disagree with you, Mr. Reuter, because, again, I trust my judges, and they have begged for drug court money. They said they'd almost rather have drug court money than almost anything else because they see that it works. You have an opinion on that, Dr. Christopher?
I do. The drug court process, we at the Kellogg Foundation, which is another hat that I wear, are actually funding drug courts in Michigan because we find them to be extremely effective, particularly when you talk about the impact on child welfare and family dissolution. So many of the cases that come into the system of where children are being removed has, of course, to do with various forms of substance abuse. So being able to use this type of approach has proven to be extremely effective.
Thank you all. I see my time is up.
Mr. Cummings, if I may comment on that as well. The drug court program, I think, has been very effective in targeting a certain population and needs to be expanded. It hasn't really seen much growth in the past 8 years, and I think we're all pleased to see the budget request that came in. One element of the drug court program that I think is very important that's often overlooked is the Drug Court Institute that's currently in place. It's only funded, I think, at around $1 million, but it puts information on best practices that is disseminated to all drug courts nationwide. And as we expand the number of drug courts, I think it's also very important that Congress help this institute grow with it so it can help all these drug courts be more effective and get a little bit more mileage for the money that they are getting.
I thank the gentleman. Thank you. Chair recognizes Mr. Jordan.
Thank you, Mr. Chairman. If I could, first of all, ask unanimous consent that two attachments be included. One is a Harvard Journal on legislative article entitled Back to the Future, the Collapse of National Drug Control Policy and Blueprint for Revitalizing the Nation's Narcotics Efforts, and the other is a second study done by Mr. Charles entitled Economic Thinking on Addiction and Legalization. Thank you, Mr. Chairman. Let me go right to you, Mr. Charles, because I actually have to run here in about 3 minutes. Your number 4 point, you were really strong on talking about why we should not have any decriminalization of drug use, and you made just, you know, more drugs mean more addiction. I mean, it's pretty common sense. I mean, makes sense to me. Just elaborate on that point, if you would, and then I have one other question.
The nutshell version is you can talk to Herb Kleber up at the Columbia University Substance Abuse Center. I mean, there's research. It's pretty clear when you have more availability and more use, you get a percentage increase in addiction. Over years, that becomes an increasing problem because you get more and more sick people.
Give me your comments then on needle exchange programs.
Needle exchange programs, for which there is a lot of divided research, basically don't do what they're credited for doing. The reason for that is that the word exchange actually is a bit of a fiction. It's really a needle giveaway program because addicts, and you can talk to the addicts themselves, tend to get themselves in a position where they want the drug, and so they want it. Heroin happens to be a very addictive drug. Other intravenous drugs are usually high potency, and the result is that they don't go back and exchange the needle. So there's more and more needles out there, never mind the moral message you're sending, which is somehow drug abuse by injection is okay.
And give me again, Mr. Charles, your background.
My background
for both R&D, Republicans and Democrats, you worked for both here?
I have worked with Mr. Cummings quite a lot over the years, as people know, but I worked, my background is I have a graduate degree in both economics and in law. I litigated, I worked in the Reagan and Bush White Houses. I then became a litigator, worked writing a bunch of these things, and then taught at Harvard for a short period of time. Became a staff director for Speaker Hastert, ran the drug task forces, and then later wrote a book on narcotics and worked for Colin Powell.
One of the other points you made in your testimony, and just for the remaining few minutes I got here, the link between terrorists and druggies. I think you named off every terrorist group that I've ever heard of, I believe, from
actually, there are many more that I didn't name.
The ones that I've heard of, at least. Talk about that link and the impact of interdiction efforts in dealing with that linkage between drug use and terrorist activity.
There is another elephant in the room, and that other elephant in the room is the very tight relationship that exists worldwide and in the United States. Talked with some of the Haidas about ongoing investigations into Hezbollah in the United States. Talk to the Haidas, they'll tell you. There is a very clear link between drug funding and the growth of terrorist organizations of all kinds and larger international criminal organizations. The terrorist organizations, believe it or not, that we worry most about, and I won't detail them, although Hezbollah happens to be the largest terrorist organization in the world, they are increasingly dependent on drug revenue. And what you find is, and this is your job as a congressman, not mine, is that there is a great stovepiping which creates the elephant in the room, and nobody wants to talk about the drug terror nexus. The great stovepiping is that DEA, God bless them for everything they do, deals with just drugs. And CIA and others in the intelligence community tend to focus their resources on CT. In fact, they have bled dry the CNC component of CIA in order to do CT work. Nobody wants to talk about the other part of this. And the reality is that in the quiet of the night, while we do not have proof beyond a reasonable doubt that every organization is getting the majority of its funding from drugs, we have more probable than not. And if we wait for proof beyond a reasonable doubt, we'll be looking down the barrel of another 9/11.
Mr. Charles, it's one of the reasons, and if you were here for the early testimony with the director, I asked him about how he interfaces with Homeland Security in trying to address this very
point blank. There is a statutory provision which was put in by Mr. Souter and Mr. Cummings that allows him to interface directly with DHS through the CNE office. It has essentially been an unutilized office. And what you have now is some hope, and I'll tell you why. In addition to, and you're hearing this from a Republican, I'm not only hopeful because they've put back a lot of the money on law enforcement, they've put back a lot of the money for critical things we need, but you've got Rand Beers, who is an all-time drug warrior, a guy that ran INL, the $2 billion bureau that I ran for Powell. He ran it before me. And that person, Rand Beers, is now, I think, the number 2 or number 3 at DHS. He cares.
But this ability, I mean, this is something I think it's so important, and I'm hoping that the chairman here is going to look into this more as well, is this ability for this office that we're talking about today, Mr. Kerlikowske's office, to interface with Homeland, that's critical.
It is critical because there is no doubt in my mind, nor in the doubt of any serious law enforcement officer in this country who looks at CT and CN issues, that is counterterrorism, counter-narcotics, that the link is intimate.
Mr. Chairman, again, I hope that's something that we can really delve into in the future because and the importance for national security.
Thank you very much. Mr. Charles.
Yes, sir.
Thank you. Thank you. Given your position in 2003 to 2005 as Assistant Secretary of State for International Narcotics and Law Enforcement Affairs, do you have any theory as to how it is that during the United States presence in Afghanistan, the production of opium shot up 80–90%?
I have a very, yes, sir.
Do you have any theory about that?
Oh, I have more than theory. I have the facts.
Tell me, how did that happen?
There were a number of people like me, Rich Armitage and Colin Powell, who argued very strongly that counter-narcotics should be a piece of the mission, that ultimately the better part of the funding for the Taliban and even remnants of al-Qaeda and IMU and HIG that were active in Afghanistan and surrounding areas, that the better part of the fuel was all drug money. The basic argument was that if you want to stop a combustion engine, you don't keep poking your fingers into it and trying to catch individual terrorists, which is what we were doing. You do that in combination with cutting off the fuel for the engine. And what we did not do, what we never implemented, because we were not allowed to fully implement, was a counter-narcotics strategy. I wrote 13 different counter-narcotics strategies at the behest of the NSC. Every single one of them got a nice read, and that was where it ended.
And you're talking about specifically with respect to Afghanistan?
I am talking about specifically with respect to Afghanistan.
This subcommittee would be happy to read those reports.
Well, I'll tell you, the better part of that strategy still sits on the table over at State.
I mean, I think that, that the American people who are sending their sons and daughters to Afghanistan and who have, we've lost quite a few men and women there. And we have seen the Taliban in resurgence for quite a while. And you've testified that these organizations are being fueled with the help of drug money. And we've seen that there's been an 80–90% increase in opium production. Of course, then we're talking about an increase in heroin sales. And so if there's that link there, that's something that we ought to explore, especially since you said that a critical part of the strategy was left out. Now, Mr. Reuter, do you have any comment on that at all?
Yes. I mean, if in fact there were...
Is your mic on, sir?
Sorry?
Is your mic on? If not, if it is...
It's on.
Pull it closer so we can hear it.
Sorry. If there were in fact a strategy that could reduce opium production without imperiling the Karzai government, then indeed this government should undertake that. No such strategy has been proposed.
So you're saying any kind of a strategy to reduce...
I beg to differ.
Hold on, Mr. Charles, I'll ask the question, Chair.
Yes, sir.
And you'll direct your comments to the Chair. So are you saying then that the Karzai government is actually being supported by the increased opium production?
I mean, the effort to eradicate crops in the field is an action against peasant farmers in Afghanistan. They are politically important simply because they're large in number, not because they're particularly well organized. The reason that the military, not just of the U.S., but the military of other countries present in the coalition forces as well, have been resistant to implementing any of these programs is precisely the perception, and I think a perfectly plausible one, that this would in fact endanger the central government that we have helped form. And it is that tension which is at the heart of the fight between the State Department and Defense Department. And Mr. Charles has a view about that, and others disagree with it, but that is the tension, and there isn't any way that I think sitting out here we can resolve it, but it is clear that if we push, let me just say one more thing. One of the things we can do is push production out of areas which we control into areas that the Taliban control. And that, I think, if anything, worsens the problem in as much as it increases the funding base of the Taliban.
I'm going to go to you in a minute, Mr. Charles. I just want you to respond to this question, Mr. Is it Reuter?
Right.
How do you explain that with the U.S. military having such a large presence in Afghanistan, that during the same period of time we see such a rapid increase in opium production? How does that happen?
Okay. Let me make two comments about that. First is about the rapid increase. Essentially, after 2002, the levels of production returned to where they'd been before the Taliban had imposed a ban in the year 2001. So most of, until 2005, it was just back to where it was before. I think the estimates for 2006 and 2007, which show very large increases, are quite implausible. There's no evidence in terms of the decline in price in Afghanistan or increased availability in the rest of the world that there has, in fact, been a very large increase. So I'm quite skeptical of those figures. Nonetheless, your question is perfectly reasonable, even without those increases. It is clear that that the crop is grown openly through much of the country. It gets moved around. There have been times in which provinces have been cleaned up, and it moves elsewhere. And that is indeed what our policies can do. We can move it around. But we do not have the control on the ground to be able to
Thank you, Mr. Reuter. Mr. Charles, would you...
With all due deference, the numbers were in the tens of thousands prior to the Taliban locking it down in 01. They went to 30,000 in 02, 61,000 in 03, 214,000 in 04, and more than that in 05. Yes, they are higher now in 06 and 07. Your numbers are exactly right. They supply more than 90% of the world market. And are they accurate? Well, both commercial and closed satellite photography seem to suggest they're highly accurate, number one. Number two, there is a strategy. The strategy is a combined strategy. It is a strategy that has worked in other countries around the world for 30 years, and it involves putting alternative development hand in glove with eradication that is effective. And Mr. Cummings' point about effectiveness is so valuable. Getting at it one by one, region by region. And by the way, the crop does not move around dramatically. To a large extent, the north of Afghanistan has never been a big poppy growing area, except for parts of Badakhshan. But in the provinces that are most heavily populated now by the Taliban, drugs are the primary driver of income for that group. And the saddest part about this is that this is an utterly winnable effort. If we would sit down, look again at the strategies that were put forward by Colin Powell, by Rich Armitage, by me in a prior administration that were essentially sidelined because they were too. Here's the real bottom line. And I'm going to really step on some toes here. When the field commander, who happens to now be the ambassador, was in charge over there, they took the view that this was highly inconvenient, that essentially addressing the drug issue was highly inconvenient. You could put it down there in a social category like hepatitis and deal with it later. The problem is anybody who knows counter-narcotics, anybody at this table, most of the people in this room know that it is an enormous accelerant of instability when it's allowed to go, just roughshod over a society. And so what transpired was every military commander, I spent 10 years in the military, every military commander has a 2-year tour, give or take, and they know that it can auger in after they leave. So it was too hard a problem to address at that time. And at the end of the day, we are now paying for inactivity. We are now paying the price for not having tackled at the front end. And I testified in front of this committee 5 years ago saying identical things to what I'm saying now, and I'd get my knuckles rapped when I went back, But the bottom line is I always told the truth, and I'm telling you the truth now.
Well,
it's winnable, but we're not doing it.
I want to say to Mr. Charles and Mr. Reuter that this paradox of increased U.S. presence in Afghanistan and sharply increasing production of opium and therefore heroin, where Afghanistan, according to figures by our own government, is achieving a larger and larger market share worldwide. That's right. There's something wrong with that story.
Can I tell you what it is, sir?
What we need to do...
Here it is, sir.
No, just... What we are going to need to do is to talk to the full committee, talk to Mr. Towns about looking at this again and get some resources in so we can have a more penetrating analysis. As I've been following this Iraq war, to me it's been, or the Afghanistan war, it's been mystifying how we could see such a
But,
sharp
sir,
increase.
at the end of the
And
day-
you just, thank you, Mr. Charles, you just explained one possibility, and I appreciate the mitigating circumstances that Mr. Reuter brings up. I'm going to move on to another part of the question here, and to Ms. Christopher. The NAPA report suggests that it is critically important that ONDCP be a data-driven organization seen by other drug control agencies as an honest broker of drug use trends and other data reflecting success and failures of drug control policy. For example, NAPA is critical of ONDCP's focus on marijuana as a gateway drug, associating early marijuana use with addiction to other drugs later in life, since there's data showing that there are other gateway drugs that are more associated with leading young people to greater drug use than marijuana. If drug prevention policy were to be based on science, should we be focusing more on teen use of alcohol and tobacco, and how can ONDCP present data in a more neutral and legitimate manner?
Thank you for the question, Mr. Chairman. The Napa report does emphasize the importance of a more collaborative and outreach-focused strategy, and we believe that the current director has made proactive steps in addressing that particular issue. And certainly the limited focus on marijuana does negate or not pay enough attention to the role of alcohol and tobacco, for that matter, in leading young people to more extensive use of other drugs. So we definitely encourage a broader scientific and evidence base to inform the overall policy, and we encourage a comprehensive strategy that looks at all of the issues that are before the committee today.
Thank you. Mr. Carnevale, can you explain your proposal for a modified budget certification process and how you think the budget should be structured to ensure that Congress and the public are aware of all drug policy spending?
Yes, this is one area, Mr. Chairman, I think that's very critical. Budget certification is a tool that the Office of National Drug Control Policy has to help it shape budgets that its federal agency partners have put together during the year before OMB sees it. Certification was reviewed by the General Accounting Office back in 1999, and they looked at a decade's worth of effort with respect to the certification process, and found that the tool was highly effective, even though we had only, in a quote, decertified about 10 agencies over the entire 10-year period. If certification is used correctly, then what you do is put peer pressure, in a sense, real pressure, because you're speaking from the White House, on your partner agencies to, in fact, do what the President wants, which is to support the President's national drug control strategy. So in terms of the process, there's two things I'd like to suggest. One is, under current law, certification, the tool itself has been badly damaged, I think. Every time ONDCP certifies a budget, it now has to report to Congress, and so what that results in is a fear to use the tool itself, because the Congress can disagree with ONDCP as it's trying to manage the budget process. But setting that aside, I think in terms of improving the process, there's been a dramatic change, as the Napa report correctly finds, in how we account for drug control spending. ONDCP, under the previous administration, threw out about 30 agencies, I don't have the exact number, out of the drug budget, and so these agencies are no longer being reviewed for purposes of certification. I think one of the recommendations that I have is that we bring these agencies back into the comprehensive accounting that Napa talked about in its report. That's number two. But with certification, I have sort of a lengthy explanation in my testimony, but I can now envision a two-tier process where a handful of agencies get certified, and these agencies would be the ones that have a very active role in making policy work. For example, thinking about treatment, thinking about prevention, prosecution, investigations. These are areas where you can put resources in and have an immediate effect. When you start thinking about the Bureau of Prisons, which houses well over 50% of its incarcerated population is in there for drug-related reasons, we no longer score them or treat their budgets as drug-related. But in a policy sense, I would argue that part of that makes sense. In the second tier, you wouldn't decertify or certify that budget because the Bureau of Prisons can't actively, through policy, decide one day it's going to increase its prison population to 80% drug-related. And so we've proposed a two-tier approach to the certification process in our testimony, or in my testimony.
Thank you. Now, your testimony states that while drug use among youth has been on a general decline since 1996, data shows softening attitudes related to disapproval of drug use, which could result in the beginning of an upward trend. You also cite an uptick in the 8th and 12th grade use of illicit drugs from 2007 to 2008. Given this data and the general decline in resources allocated to prevention in the last 8 years, isn't the proposal to eliminate the state's grants portion of the Safe and Drug-Free Schools and Communities program short-sighted? Are you concerned that if drug use rates rise without this program, there will be no safety net in place to deal with, and shouldn't we be putting more, not less, resources into prevention programs?
My answer to the short-sighted part of the question is yes. I think it is short-sighted. I'm very concerned. I looked at the Department of Education, the Office of Management and Budget's recommendation clearly, and there's a Department of Education report about the program, and it doesn't say the program doesn't work, the state grants portion of the state portion of the program. But what it does say is that the program has been badly mismanaged, and it has been for the past decade. And I'm greatly concerned that OMB, in this case, is using that information to cut a program simply because it's been mismanaged. I'd rather see, I think at this point, given what we're seeing with attitudes changing, and these attitudes have to do with the softening of attitudes with respect to the disapproval rates around drug abuse, the dangers of drug abuse. We're seeing upticks now that are not statistically significant, but we saw this happen back in 1990 and 1991 and 1992, when suddenly youth drug use exploded, and all the telltales were there. I'm really concerned that this program be saved. If the issue is one of mismanagement, which I think is a strong tradition at the Department of Education, but it has been one that's cut across many administrations, then I think it's time that we take the funding for this program and have it transferred to Ondcp and let them decide which agencies can best use that
Thank
funding.
you, sir. Mr. Reuter, did you have a comment on that?
I'm co-author of the report that was cited as a basis for cutting the program. It was a report done in 2001, and perhaps things have changed. But at the time, I would say it's not mismanagement so much as it's just a poorly structured program. It's essentially a formula grant program which imposes very few obligations on the recipient schools, and that's built into the structure of it, and I don't think any better management is going to change that aspect of it. You would have to make a very fundamental change in the law, and putting it in the hands of Ondcp would make it an utterly different program. But in the form that it is now, where it's essentially a formula grant, there is nothing here that suggests that this is an effective way of funding effective prevention programs. You can rewrite the law, but there's not a management issue.
Well, let me ask you this. You conducted a RAND study in 2001
Yep.
and concluded that the state's grants portion of the SDF-SC program was profoundly flawed. Have you conducted any additional studies on the program since the passage of H.R. 1, which sought to legislatively correct some of the problems with the state grants portion of the SDFC program? And your report, as you know, is cited in the 2010 budget as justification for eliminating the program. Is it applicable to state grants portion of the SDF-SC program as it's currently legislated?
I have not followed this program further, so I absolutely cannot answer that question. If there have been made fundamental changes...
That what?
If fundamental changes have been made, I simply don't know about them. So I can't answer your question.
Well, we'd like to hear from you about those fundamental changes, which, of course, would change your level of analysis. So, just to say there's fundamental changes begs a lot more questions. If you could, the committee's going to send you a note that would give you a chance to elaborate on that.
Sure.
I want to thank all of you for being here. And is anyone on the staff here from the Office of National Drug Policy? Good. I'm glad that you're here so you could take notes back and discuss some of the testimony. And so I want to thank Director Kerlikowske and his staff for being present, as well as the other witnesses who are here. We want to continue to engage you and your expertise on these matters as we move to craft a sensible national drug policy. This is the Domestic Policy Subcommittee. I'm Dennis Kucinich of Ohio, Chairman. We are a subcommittee of Oversight and Government Reform. Today's hearing has concerned the Office of National Drug Control Policy and fiscal year 2010 National Drug Control budget and the policy priorities of the National Drug Control Policy under the new administration. Our committee will maintain, and subcommittee will maintain, an ongoing jurisdiction in this matter, and we appreciate all of you participating, and we'll be talking again. Thank you very much. This meeting stands adjourned.